Biology Nini from Savita Engineering College, and our topic is about early prediction and intervention in systemic lupus erythematosus (SLE). And this is the disease where we can see the joints, kidneys, heart, and lungs will be damaged soon. The presentation explores the challenge of diagnosing systemic lupus erythematosus (SLE) early is critical to prevent irreversible organ damage like lupus nephritis, which will be occur in kidney. However, the complexity of the disease makes early prediction difficult and intervention controversial. And this is the introduction. Systemic lupus erythematosus (SLE) is a serious autoimmune disease where early detection is critical, but current diagnosis often comes too late after irreversible organ damage has occurred. Our solution leverages artificial intelligence to accurately predict disease progressions, enabling timely intervention for those at high risk while safety monitoring others. The challenge lies in the distinguishing who will progress to severe lungs from those with early warning signs. Treating everyone risks harming people who may never develop the disease, while waiting too long allows permanent damages. The early symptoms of SLE are very common and confusing, such as tiredness, joint pain, fever, skin rashes, etc. And this approaches ensures the right patients receive the right care at the right time. And our problem statement will be lupus is a serious disease where the body attacks itself. By the time it's diagnosed, permanent organ damage often already existed. And the current issue in India is early warning signs exist, but most people with these signs never get severe lupus. They used to leave that as a careless thing, which could get that to the failure of heart or kidney. If we treat everyone with warning signs, we are overtreat and harm people unnecessarily. If we wait too long, organs get damaged. And our solution in this project is we use AI to accurately predict exactly who will develop severe lupus from early warning signs, so we can treat high risk patient early to prevent damage, avoid necessary treatment for low risk. And our goal is right treatment for the right person at the right time. And this is our full of problem statement, where the systemic lupus erythematosus like SLE is a chronic non-curable autoimmune disease in which the immune system attacks the body's own tissue, causing inflammation and organ damage. Currently there is no single definitive diagnostic test for early stage SLE using patient clinical symptoms, laboratory biometrics, ANA, anti-DNA complement level, ESR, CRP. These are the tests which should be taken for SLE to prove SLE is there or not, and in which state it is there. So urine protein analysis and demographic data, it is possible to develop a machine learning based predictive model to identify patient at high risk of early stage SLE, predict flare occurrences and early disease severity, provide interpretable insight for clinical guide timely intervention. And in this image we can see these are the first form which we can get joint and muscle pain, mouth sores, nervous system problems, skin rashes, kidney involvement, retina problem, fever. And it will not this all symptoms will not cause a person at a time. There will be something like how some person will get air loss, fatigue, thrombocytopenia, lungs and heart inflammation, but the other one will not have these symptoms. It will vary the people's genetic also. And who is most at risk for SLA is mostly women's 90% of SLE cases because of their hormones and the chromosome, ethnicity African America, Hispanic, Asian, Native American. Like the X chromosome have the most of immune, which could which women have two X chromosome, so it will attack women easily other than men. Men has only 10%, but women has 90% of this SLE cases. And it is a genetic disease which family history, autoimmune disease in relatives. Common symptoms is severe fatigue and fever, butterfly rash, joint pain and swelling, kidney, heart, lung inflammation, sun sensitivity. Root cause is autoimmunity. Immune system attacks body's own tissues, producing anti-DS DNA antibodies that cause chronic inflammation. And this is the flow chart which we have worked data ingestion. We start by feeding the system all the patient information, both subjective symptoms like fatigue, joint pain, and objective lab tests like ANA, anti-dsDNA levels. This massive amount of historical and real-time data is prepared for the AI engine, and doctor act early the outcome. The doctor receives the objective risk scores. This crucial piece of information justifies initiating timely preventive treatment years before irreversible organ damage like lupus nephritis can occur. And in this flowchart, we can see first patient data and symptoms, then data cleaning and preparations, then new patient's data output, then AI model. We have trained the AI and machine learning. It have been trained to predict the risk score and label whether it is early stage or uh, uh, high or low labeled. Doctor review, routine monitoring, and this is the early intervention will be done. And this is our output by Linux software. We have used Python. This is the code. In this code we have returned patient id like Raji, age 20, gender is female. And with this lab results, we can conclude whether they are in early stage or in last stage of SLE. We can also conclude if they have SLE or not by this program. SLE prediction. The program trains a machine learning model to predict lupus risk. You enter patient lab results, symptoms. It gives back risk percentage 0 to 100%. Color coded risk level red, orange, yellow, green, like that we can configure that. Medical recommendation, you can test multiple patient and save all result to a CSV file. Simple input, instant risk assessment. And this is the window command which we have done. The model validation, result meaning, and clinical risk scoring. High result patient as an 87.6% probability. This high confidence scores justify early intervention to prevent organ damage. Low risk patient have assigned 22.4% probability. This low score prevents the patient from being overtreated with unnecessary toxic medications. The ANA will not only for SLE, it is only for antibodies which have been stored in our body. And we have compared India with other foreign countries also. By that we concluded that financial and access barriers, specialized scarcity and awareness gap, social economic status. The biggest problem is there is no awareness in India whether the people don't know and they won't check immediately. But in foreign countries they will check immediately, so in early stage itself they have cure. But in India they won't cure. If their kidney or heart damages only, they go to hospital. And this is our conclusion. The challenge, SLE's diagnostic delay leads to irreversible organ damage and immense suffering, especially in undeserved regions that current system cannot reliably distinguish high risk progress from design cases. The solution and the vision can be done in the conclusion, which we have intercept SLE before it devastates lives with precision prediction. We will not just manage lupus, we will prevent its most damaging consequences, unleashing in an era of personalized and preventive autoimmune care globally. Thank you.